Whether it's for a quick checkup or procedural care, they provide personalized services to help you stay healthy and happy. Dr. Eric Stonick, Chief Medical Director of DoctorsNow, is here to share more about their clinics and all the services you have. Talk to us about primary care, how long that's been available at DoctorsNow.
So primary care is relatively new to our practice. Been going for about a year now. Our nurse practitioner, Tracy Drinkard, was the catalyst to launch this program. Her and my brother, Dr. David Stonick, practice out of our West Des Moines location. And we also offer primary care out of our Altoona location with Mary Carr Peterson, who's a highly experienced, highly competent provider. And I also do primary care out of our Altoona location.
And we were talking in break, DoctorsNow known for urgent care. You were saying, though, you want to see people before they need to go to urgent care to hopefully keep them out of urgent care.
Yeah, that's right. You hear a lot of doctors say that an ounce of prevention is worth a pound of cure, and I think it's absolutely true. Being in poor health and being metabolically unwell weakens your immune system and predisposes you to injuries and bacterial infections and pneumonia and stuff like that. So we like to see people when they're well. It's common for people to wait until they're sick to come see us, but we like to see you when you're well so we can learn more about you, your health history, your family history, and stuff like that.
So is that why it's important to find a family medicine doctor, build that relationship?
Yeah, it's important that when you do get ill, that you're able to see somebody who knows more about you. When you first come in and establish with us, we like to know your medical history, surgical history, allergies. If you take any prescription medicines or have been on prescription medicines before, that's all very important. But we also want to know more about your day-to-day life, what your living situation is, if you're married, if you have kids, what you do for work, what you've done for work in the past. And we also want to know about your family history as well, because family history is a very strong predictor of developing chronic disease, and we try to get in front of that as best we can.
So that's good information we need to know when we come visit to have ready for you.
Yeah, it's very important, because if you've had direct relatives who have suffered from cardiovascular disease, cancer, dementia, diabetes, things like that, these are chronic diseases that take decades to develop, and there's identifiable risk factors that we can catch beforehand. If we can get these risk factors addressed, the healthier you'll be as you get older, the higher your quality of life will be, and we can help to keep you free of chronic disease.
You have different payment plans available too. Talk to us about all those different avenues.
Yeah, so your traditional health insurance, like your Wellmark and United, Medicare, Medicaid, we accept all of those plans, and at the end of the day, the most important thing is that you have a family doctor that you know and trust. So we're happy to see those patients. But we also offer a service called direct primary care, which is, as the name suggests, it's a direct relationship, direct transaction between the provider and their patient. So it cuts out the middlemen. It includes all of your generic medications, labs, x-rays, things that you would get through a primary care doctor. But there's no surprise bills, no co-pays, no deductibles. We try to cut insurance out of it so that we can have a better relationship with our patients.
Okay, and I think we have more information about all those different services that you offer with the direct primary care, or the primary. So annual wellness exams, preventative screenings, chronic disease management, and medication management. So again, all those things to really keep you well and keep you healthy.
Yeah, all of that is included under the monthly fee. So we don't have to factor costs in too much when we're in a visit with our patient. And it's also a service that we offer to employer groups as well. If employers are seeing that the rising costs of premiums are being difficult to manage, or for smaller companies that just can't offer health insurance benefits to their employees, direct primary care is a great option for employer groups as well.
Well, thank you so much for being here to share this with us today. We appreciate it, keeping us healthy.
Yeah, thank you.
And you can learn more, just go to DoctorsNow.com or call 515-471-1860. You'll find locations in Altoona and West Des Moines, and you can see more on social media.